ನಮಸ್ಕಾರ ವೀಕ್ಷಕರೇ, ವಿಕಸನ ಟಿವಿಗೆ ಸ್ವಾಗತ. ಇಂದು ನಮ್ಮ ಜೊತೆಗೆ ಸಂವಾದದಲ್ಲಿ ಇರುವಂತಹ ವಿಶೇಷ ಅತಿಥಿ ಭಾರತ ಸರ್ಕಾರದ ಯೂನಿಯನ್ ಮಿನಿಸ್ಟರ್ ಫಾರ್ ಹೆಲ್ತ್ ಆ್ಯಂಡ್ ಫ್ಯಾಮಿಲಿ ವೆಲ್ಫೇರ್ ಇದರ ಮಿನಿಸ್ಟರ್ ಆಗಿರುವಂತಹ ಡಾಕ್ಟರ್ ಭಾರತಿ ಪ್ರವೀಣ್ ಪವಾರ್ ಇವರು. ಅವರನ್ನು ಈ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಆತ್ಮೀಯವಾಗಿ ಸ್ವಾಗತಿಸ್ತಾ ನಮಸ್ಕಾರ. ಮೇಡಮ್, ವಿ ಆರ್ ವೆರಿ ಗ್ಲಾಡ್ ಟು ಹ್ಯಾವ್ ಯು ಟುಡೇ ಇನ್ ದಿ ಸ್ಟುಡಿಯೋ. Your journey from Nasik to New Delhi, what actually led you from Nasik to Delhi, the parliament? Can you just tell few words about this?
I think my journey started, I have started from Panchayat, Zilla Panchayat member. As a Panchayat member, since 7 years I was in that field. And Honorable Prime Minister Narendra Modi ji, as they always encourage women empowerment.
Yes.
And they got the chance to serve the nation by women also. So through that chance I got the opportunity to serve as a member of parliament.
Yes. So maybe know what is the actually that drive that led you towards this parliament?
Exactly, when we are in such a social field, so when we saw, as a doctor, I was very ground level, I work in a very ground to reduce the malnutrition, provide the pure water. So such projects, I was work on that. And I think the people like the social.
Yes, we are very happy to see that being a part of the social issues, which is a concern of every individual human being. You have seen the last man's struggle and that led you to represent the last man in the parliament. Very happy to hear from you, ma'am. Ma'am, you are the first female representative to the parliament from your place, Dindori, Nasik. Now, how you feel as a women representative to represent the entire women of your constituency?
And I am the first woman parliamentarian from my constituency, and see how much time it took, around 70 up to 70 years.
Yes.
When Modi ji has become the Prime Minister of India, then the girl like I got the chance, about female like me got the chance. So I think this is a visionary leadership, the vision of the leadership.
Okay.
That is the only possibility for us, people like us who are actually doing the groundwork. So many females, which I could see in the parliament, but the number of females are more in BJP party as MPs.
Yes, we are very happy to see that the women representative in the parliament who can represent the voice of each and every one and the last man of the society as a whole. Coming to Indian health sector, you are currently your position being a welfare and family ministry. Coming to this Indian health sector, there are various health plans such as the National Health Mission, the Rural Health Mission, and number of the plans that Government of India, especially the Modi ji, has started many programs. Can you just tell us about the progress of such plans?
It's exactly as rightly you said, like NHM, National Health Mission, and now Honorable Prime Minister Modi ji's vision is to reach last mile. So he introduced so many schemes, including Ayushman Bharat, health and wellness centers. So now near about 1.5 lakh health and wellness centers are functional at very ground level. And they are doing like screening, providing the basic treatment, primary level all over India. And also Pradhan Mantri Ayushman Bharat Jan Arogya Yojana, this is the one of the biggest insurance scheme, through which we are providing 5 lakh support to the family, to the patient for tertiary care, for taking operations. So this is the world's largest scheme, I must say. Again, concentrating on the digital technology. So Honorable Prime Minister wished to make the digital identity. So Ayushman Bharat digital mission is also scheme is program is also going on. Through that we are creating the digital family health records. So to we can provide the details to the patients so to get the fast treatment from doctors. And after COVID, we realized that we need to strengthen more in the health sector. So Honorable Prime Minister has given one more very good scheme, Ayushman Bharat Health Infrastructure Mission, through which near about more than 62,000 crores budget has been provided. And we are providing the labs and critical care blocks. So the basic structure we are providing each every district.
Okay.
So these are some very great initiatives from our department.
Yes. We are very glad to see that Government of India has took lot of initiative to benefit the common man. But when we consult the common man, the biggest answer or tragedy what we see is they have a lack of awareness. That is the one challenge that we faced. Madam, being a Minister of Health and Family Welfare, what are the challenges that you faced to implement all these programs to the last man of the society?
Exactly, you have correctly said that in some part of India we are facing the awareness problem. So the scheme is there, the budget is there,
Yeah.
the scheme for the mother and child, so many. So this our focus is to provide the awareness, and now we are focusing over that awareness system also, and including our primary focus on primary level healthcare. So our focus is to give the simple and basic facilities in primary health centers.
Health centers.
So strengthening of primary health centers, including the portals. Some portals are, we are getting the feedback from the portal, and it is easy to track the patient, like our RCH portals for mother and child health. So through that portal, we are trying to track the patient. So the focus is to provide the best service to the
Okay.
last.
Yeah, Madam, after taking up all these projects, do you think strengthening the rural health sector will improve the Indian health sector?
Exactly, you have correctly said, as we are aware that some part are they are staying in rural and some are in urban. So urban there are a lot of facilities,
Yes.
but still in rural we are having the challenges. And in last 9 years under Modi's visionary leadership, our focus is to enhance the medical, including the medical education and including the medical facilities. So when if you see the number of medical colleges which were previously built in 2014, where it was near about 348, now the numbers are more than 700,
Yes.
including the medical seats. When the MBBS students that time 14, it was a number only 51,000 MBBS seats. Now it is more than 1 lakh.
Unlike.
So the education, the treatment part, service, so the focus and the challenges are here, but we are facing that and we are promoting that.
Yes.
Challenges.
Yes, coming to the Indian statistics, as far as the health service workers are considered, it is said the proportion is very less. Compared to the Indian population, the health service workers, including the ASHA workers to the doctors level. What is your opinion about this?
Right now we are in a good position as WHO has given us some criteria to fulfill the doctor-patient ratio. Now we are achieving that because the Honorable Prime Minister has separated Ayurveda, homeopathy, that Ayush Ministry separated. So that is also one benefit we are getting the doctors from that specialist also from that side. And now we are doctor-patient ratio is good as given by WHO. So our aim is to still to focus to strengthen more doctors
And health workers.
and health workers. In recently we have started so many courses. So doctors plus these paramedics will fulfill the gap.
Yes, Happy to
rural,
note this
rural areas especially.
that India will stand in the
Yes.
entire universe in the health sector also as soon as
Yes.
possible.
Additionally, we have started our teleconsultation
Yes.
through e-surgery.
Yeah.
That is one of the good and very great example.
Yes.
In the rural part of India, we are connecting the patient, the doctor, to the tertiary care doctors, specialist doctor. So that is also one of the good the connectivity. So when patient has not good travel to so far district level, so from primary level health center also he can get the suggestion, the treatment part, or he can ask the doctor. So this is one good step.
Yes.
Through teleconsultation.
Yeah, India is progressing in health sector too. That's
And still until date, I think we have crossed more about 14 crores teleconsultation.
Teleconsultancy.
So the number is very good.
Okay.
In every state, every district in remote areas.
Yes, happy to note this, ma'am. Being a best female or women parliamentarian award that you have received, and you took the charge during pandemic time. What was the greatest challenge for you to lead your particular domain?
Exactly, you rightly said that it was very tragic and very challenging. It was a challenging time. But Honorable Prime Minister was always 24/7. He was on record and he was there to support and to guide us.
Yes.
He more than 20 times he took the meetings through VC to all the chief ministers from the all states.
Okay.
And every time he was asking that what kind of support you need from the central government or any type of medicine and vaccine and equipment. He was very much alert, and regular review was taken. Our Honorable Minister, Cabinet Minister Dr. Mansukh Mandaviya ji is also he was also very active mode. So very daily we are on feedback and follow-up mode, so that and through that coding portal, so it was very easy to track where our vaccine is going, where we are having the reports. So that time was very tragic, but I must say thanks to all the health workers, the nurses, the doctors, the manufacturers, and all the people of India. Because of all of them, we can achieve the major number of 220 crore vaccinations successfully.
Yes.
Success drive, I can say, which is possible with only in India.
Thanks to health sector, because the entire battle was won by Indian health sector because of the contribution of each and every health worker. We can say that one. Madam, one thing is very interesting to note that your domain of interest, that your studies, you have pursued your medicine. Now you are working in the same field. You are leading that particular sector. What was the greatest challenge that you had to lead your sector?
I don't think that any big challenge, but you have to do hard work, steady work, and as Vivekanand ji is always your power in his thoughts, that all power is within you. So just you can do anything and everything. So I believe when I follow
What do you
energy.
What do you learn, what do you teach, what do you preach? When it becomes one and the same, success will definitely follow you. That's what you are a model for, that particular word, I think. Madam, coming to one more question. Country has celebrated Azadi Ki Amrit Mahotsav, and we are ranking in the top positions in the world health sector as well. Now, can you just tell us India, where exactly India is standing in the entire world?
Yes, I think this is a very good and proud question for us, all of us as a women. And I think in health sector we are doing good now. Most of our patients from outside, they are wishing to come here and to take the treatment.
Medical tourism has increased.
They want to come here and take the treatment. So I think our support is in that way to promote and provide this tourism and medical value travel. This is our next vision. and also pharma sector to develop a good pharma sector, as India is growing as a pharmacy of the world. That is, and the third one is, I think, digital technology. So many countries adopt our COVID portal.
COVID portal.
So the digitally we are ready to provide. And the fourth, the last one, I think, traditional medicine. So people from many countries are coming, and as we know, WHO is also giving appreciation for the traditional medicine. So our focus is to promote these things. That is our part of culture also.
Yes, we are very proud.
Vasudhaiva
We are very proud being Indians. We can stand in the world health market as well, that we are the supreme power in the days to come in the health sector as well. Yes.
Our logo is
Yes,
to
yes.
serve others. So one family, one earth, one family, one future.
One future.
That is our motto.
Motto, yes. Madam, we are very happy to have you here. You have inaugurated our Vivekananda Institute for Pharmaceutical Sciences. The Vivekananda Vidyavardhaka Sangha is working to the overall development of the students with values. Can you just give some message for the rural youth of this particular place?
Yes. First of all, I would like to congratulate the team from Vivekananda Vidyavardhaka Sangha, because I think since the last 70 years they are in a very strengthening the good education system, right from Shishu Mandir, Polytechnic College, Law College, Engineering College, and one more to this is Pharmacy College. So I think this is the best part of everyone's life, this much achievement, and I think the hard work is the main source behind that, main energy. So for all students, I can just tell that the power is within you. So use that power, and not for just ourselves, but for others.
Yes.
So विचारों में अपने ज़्यादा ताकत है. मैं मानती हूँ कि ये ताकत को आप उपयोग करें, लेकिन अपने विचारों को उन ऊंचाइयों को लेके जाओ. सो अपने थॉट्स को अगर आप उस लेवल पे लेके जाएंगे और सेवा की दृष्टि से लेके जाएंगे to serve others, I think God will help.
Thank you very much. Madam, one last question. There is a saying, if you teach me, I may forget. If you involve me, I'll learn. What is your opinion about this?
Yes.
How the young can be involved in developing the India?
I think the young generation is very active, very smart, and I think we must use their energy in the right way to teach them in a proper way, and also culturally also connect to them in our cultural way also. So I think India is the only country really having that much power, brain power and manpower. So I think we will use, and as Vivekananda's vision as a Vishwa Guru, so we are proceeding in that way to become a Vishwa Guru. Youth, the strengthening their powers is our.
Thank you very much. There is a saying, if you dare to begin, you will succeed. We have with us today such a dare and dynamic minister, Bharati Pawar ji. On behalf of Vikasana TV, thank you very much.
Thank you so much.
Namaskar.